what naturally gives us volume in our face is fat. And from the age of 30 on, you're losing volume and fat within the face and getting more relaxation of the skin. So replacing kind for kind, meaning replacing the fatty tissue volume loss with your own fatty tissue, has always made sense. And now with the ALMI procedure, we're able to do that with less risk and with more consistent results and less complications from the fat grafting. And I think bringing that about and doing that in an office-based procedure is really where the ALMI procedure has its great benefits.
So fat grafting in the face itself is not new, but the ALMI procedure is about 6 months old. And what is the difference between the ALMI procedure and what you've been doing previously in the face with fat transfer?
Right. So fat transfer has been around for a very long time, almost 30 years or longer in some cases. Fat grafting in the face helps restore volume, and it's been able to be used from an aesthetic point of view for volume loss due to aging. There's many places where instead of using fillers, you use fat. Fat has always been somewhat of a problematic thing in that you don't know how much of the fat is going to live long term. And you can imagine that with larger particles of fat being transferred, you may have an area that has volume and an area without, and that can leave kind of a lumps and other asymmetries. The ALMI's been around, the mechanisms for using the ALMI procedure have been around for a while as well, but packaging it together under the name ALMI and putting each phase or each piece of the procedure together has really only been around for about 6 months when it was trademarked. And that portion of the procedure gives you the ability to now use fat rather than in the deeper spaces with larger particles. With now you're able to use the fat much more superficially and with smaller particles, so less chance of asymmetries and less chance of the lumps and bumps, if you will, that can be left from fat grafting being done previously too superficially.